Healthcare workers in Dallas are now monitoring dozens of people who may have come into contact with the man being treated for Ebola. That includes 10 people who definitely had contact with Thomas Eric Duncan and 38 possible contacts. 1 week ago, Duncan became the first Ebola patient diagnosed on U.S. soil. They cannot be by his side, but Duncan's 85-year-old mother and other family members traveled from North Carolina along with the Reverend Jesse Jackson to be as close to him as they can. Duncan is still in critical condition.
He's not well. He's sick.
Doctors in Omaha, Nebraska are treating freelance journalist Ashoko Mukpo with the same experimental drug teams are giving Duncan. Yesterday, Mukpo was able to walk off the medevac jet that rushed him from Liberia.
He's holding himself in a way that he said to me, I'm going to get through this.
As a precaution, national security and health teams are now mapping out a new strategy that will likely include a stepped-up screening process in at least 4 major U.S. airports. And we want to make sure you understand why this week is so critical. Doctors in Dallas say anyone potentially infected by Thomas Eric Duncan should start to get sick this week. The good news so far, though, no one in the group of 48 people being monitored has shown any symptoms of this disease. Today, Governor Rick Perry toured these labs at the University of Texas Medical Branch in Galveston, where research into Ebola vaccines is happening right now. And KXAN's Angie Bevan has more now on the action Texas lawmakers here in Austin are taking.
Texas lawmakers are now asking themselves, how can we better protect public health?
This is an informative hearing to allow us to hear, as elected officials, from our state health regulatory agency heads, as well as experts in the field of virology and infectious disease.
The Health and Human Services Committee heard from the doctor who's treating Ebola patient Eric Duncan in Dallas. The Health and Human Services Commissioner, Dr. Kyle Janik, also spoke.
This is a terribly unfortunate event for Mr. Duncan. The best we can hope at this point is to learn from it on the state end and wish him a speedy recovery.
Dr. Janik is part of the Ebola task force Governor Rick Perry created Monday. The task force is identifying areas for improvement and will work to move lawmakers to take action.
We will have lessons learned from this first patient. We need to learn them. We need to implement them. We need to change legislation as may be necessary, because we live in an interconnected world. And if there is an epidemic anywhere, it will affect us here in Texas.
Senator Schwertner says the information gathered Tuesday will help lawmakers address public health needs moving forward. In Austin, Angie Bevan, KXAN News.
The task force is expected to take their first report to the governor and to lawmakers by December 1st.
Military families are wondering what would happen if their loved ones serving overseas came in contact with Ebola. Leaders at the Pentagon said today they are confident U.S. military personnel now in West Africa will remain safe. The Obama administration announcing last month it was sending 3,000 service members to West Africa. 1,000 more could also go in. They will work at 17 treatment centers to help prevent the virus from spreading further. The Pentagon says in the unlikely event a U.S. soldier gets the Ebola virus, a specially designed aircraft would fly him or her back to the United States for treatment. It says U.S. troops working in labs are testing specimens from local hospitals to see whether patients have Ebola. The Pentagon says the troops are not coming into actual contact with sick patients.